Hello, everybody. My name is Benjamin Day.
And I'm Jillian Mason.
And this is Medicare for All, the podcast for everybody who needs healthcare.
Mm-hmm.
So, up for today, as you may know, we are in the middle of kind of a resurgence of organized labor in the U.S., which is very, very exciting. From Amazon workers to the auto workers recently, grad students, baristas at Starbucks, all racking up organizing wins. And one of the big reasons, honestly, I think, is that people want that union card, as you guessed it, to be able to get healthcare coverage and to be able to negotiate your healthcare coverage. So today we're going to be talking about union healthcare plans, how they work, how workers have managed to use collective bargaining to try and resist, the national erosion of access to healthcare that we're all kind of seeing in different aspects of our healthcare lives. And we're going to take a deep dive on why, even with better healthcare, unions have become kind of leaders in the fight for Medicare for All, and how they might hopefully save us from a corporate healthcare hellscape. So no pressure, Jim. We need help. Jillian, do you want to introduce our guest?
Oh, of course I do. We're very excited to have Jim McGee with us. Jim has spent his entire career working on union health benefits. He is such the expert that every time we asked anyone who we should have on as a guest for this show, we said, who knows about union health plans? And universally across the country, people said, it's Jim McGee. But he spent his entire career working in union health benefits. He started out with the Plumbers and Pipe Fitters local that he belonged to in Harrisburg, Pennsylvania. And for the past 20 years, he's been the administrator of the health benefits plan for Amalgamated Transit Union, Local 689, out of the DC area. And he's on the steering committee for the Labor Campaign for Single Payer Healthcare. And he's joining us today from Bethesda, Maryland. Thank you so much for being here, Jim.
You're welcome.
Thank you for having me.
We are thrilled to have you. So I'm just going to kick it right off I want to know how did you get involved with unions to begin with, and how did you have the misfortune to become an expert on union health plans?
Boy, that's a loaded question. So how I became involved with unions. So I went through a period where I was unemployed, and I applied for the apprenticeship program at Plumbers and Pipe Fitters local in Harrisburg. And 6 months later, when they were pulling names out of a hat, I was still unemployed. So I said, why not?
That's how most mistakes start.
Yeah. And then 4 years later, when I got out of my apprenticeship, because apprentices are not allowed to be politically active in local, I was at a union meeting, and a group of guys approached me and said, we're putting together a ticket, and we think you'd be a good health and welfare trustee.
And there you are.
and here I am today.
Wow.
So I ran, I got elected, and yeah.
Wow. And so was there any particular qualifications that you had that made you the go-to person for healthcare, or is that something that's evolved over the years?
You mean that made me the go-to person now?
No, I mean back in the day.
Did you know what the fuck you were doing when you were elected?
No, absolutely,
That's what
absolutely not. There is a group, an educational group called the International Foundation of Employee Benefit Plans that really provides education for trustees.
Okay.
And so they immediately wanted to sign me up for a new trustee institute, and I just thought it was a way to get rid of me.
So originally it was not the honor that maybe your colleagues thought it was.
Right. But it was a huge plus to spend a week with those guys and really get a grounding in some of the basic issues. ERISA was still fairly new at that point. So there was a lot going on.
Right. I would ask you to explain ERISA, but we might derail our entire podcast. we may have to come back to it. But do you want to just explain what relevance that had for?
So ERISA is the law that governs employee benefit plans. Although it does not govern all employee benefit plans, it governs basically the private sector plans. It does not govern government plans, and it does not govern church plans, but it is the gold standard. So even governmental plans like ours, we try to adhere to the guiding principles that are laid down in ERISA law.
And ERISA stands for something, right? It's an acronym. It's not just a pretty word.
Employee Retiree Income Security Act.
There was a quiz. There was a test.
Yeah.
I do think a lot of parents are looking for unique names for their children, and ERISA is actually kind of a beautiful name. So I'm just making a pitch for that for all the soon-to-be parents out there.
Okay.
So about 10% of Americans right now are union members. That's down a little bit from the 80s, but there has been kind of some recent union expansion in the last couple of years, which is great. And my guess is that probably most of our listeners don't know how unions handle their healthcare. Can you just tell us a bit about what union plans look like and what is a Taft-Hartley fund?
Okay, that's really two different animals, very different animals.
Fair.
So when we typically think of unions, we think of steelworkers and we think of auto workers, and we think of people that are gathered together in one place and working for one employer, or maybe multiple locations, but for one employer. And there's a collective bargaining process, and these employers sit down with their unions and they come up with demands. I just got a letter today from the bargaining parties. The Washington Metropolitan Area Transit Authority is negotiating with ATU Local 689, and they start with fact finding and laying out all their grievances, and it's kind of a little bit of horse trading, but it's also a little bit of muscle flexing.
Right.
And in the case of some, especially in the public sector, I don't know that this exists too much in the private sector, but sometimes you have, especially in safety sensitive positions like police, fire, transit workers, sometimes you have mandatory arbitration. So when the parties come to an impasse, then they submit their respective cases to arbitration, and then the arbitrator decides what gets adopted and what doesn't get adopted. Right. So that is kind of, we'll call that the union shop.
Right.
The other kind is what you refer to as the Taft-Hartley, which is the world I grew up in, and which was really kind of, in some respects, delayed my understanding and appreciation of the need for single-payer healthcare, because the Taft-Hartleys really function the way healthcare should work. When I started with the plumbers, the idea is that you pay while you're working to have health insurance when you're not.
Right.
So the Taft-Hartley world exists in industries where there's a lot of turnover, a lot of a mechanical contractor can hire. I worked in the industry for about 12 years. I had about that many employers, ranging from 1 week to 4 years. and periods of unemployment ranging from 1 week to 8 months.
Mm-hmm. Mm-hmm.
During that time, I got married. I had kids. I never thought about healthcare. It was just always there.
Right.
And that's the way it's supposed to work. Now, as healthcare has gotten more expensive, when I first started with Local 520, the requirement was that you needed to work 24 hours in a 6-month period.
Wow.
Oh, man.
That didn't last too long after I got it, but you know, and so you can understand that you know, the idea is to be able to bridge periods of unemployment.
Right.
Yeah. Right.
And
right.
with healthcare costs, you know, skyrocketing as they have over the last 30 or 40 years since I've been in this business, you know, that model is not as tenable as it used to be. But still, you know, the basic concept is there. The basic concept is you pay while you're working, so that you have coverage when you're not.
Right. And my understanding is that for these funds, you know, these are common in like in the construction trades, for example, where you might work for a developer who builds one building, but then you're off to another job, and you need a health plan that follows you from workplace to workplace. But the another difference with these is that the union actually plays a role in administering.
That is another huge difference. The other difference is that, you know, we negotiate a total wage package. Right. And so we would have to deal with the money that is negotiated into the healthcare plan. And more than once I had to go to the membership and say, you know, that 25 cents or whatever you thought was going to go in your paycheck, I'm dating myself. But, you know, we need it for the health and welfare, or we need, you know, 15 cents of it or whatever. Right. And as a result, Taft-Hartley plans feel that budget pinch a lot more than, especially in the public sector, where they're just going to pass it off to the employer, and really don't have a sense of what it really costs. You know, which gets you to this whole thing about you know, skin in the game. You know, people, you know, this logic that you somehow should have skin in the game so you know what it costs, as if that's going to make a difference.
I hate that logic. It's terrible. Why do we keep coming back to that?
Well, you know who has done one of the best pieces on that? Somebody who should know about consumer choices and whatnot. Consumers Union.
Oh, nice.
They did a really nice piece on this whole thing, and what they said is only 7% of healthcare costs are impacted by consumer choice. And the choices that are made are usually bad choices.
Yeah, I can testify to that many times over, actually.
Yeah, from so many perspectives, having heard about it and having made a lot of mistakes.
I've Google diagnosed myself on multiple occasions. Never once been right. WebMD diagnosis, don't do it. So you kind of alluded to there something I wanted to ask you more about, which is that I mean, for all of us, even if we're not in a union, there is a trade-off between our health benefits and our wages. But I think for most of us, it's kind of invisible. It's behind the scenes. Our employer maybe provides, if they offer us health care, we may not see the same, or if our healthcare costs go up from year to year, then our wages are maybe not going up as much as they might otherwise. But it's all behind the scenes. No one even thinks about it. But the really unique thing about you guys, when you actually go to a collective bargaining table and fight over it, is you get to maybe see the trade-offs. So what does that look like? I mean, you mentioned having to sacrifice, 25 cents, but I imagine now the numbers are much, much bigger about what you might have to give up to never mind gain healthcare coverage, but just to keep whatever you have, or to, limit the damage for what you're giving away for health benefits. But
well, first off, there's a couple of aspects to that. What you're dealing with, is projections.
Right.
And so you really have no idea what you're really trading off.
Right.
The only way you really know is to look at it in the aggregate over time. There's some people with more letters after their name than I do, who argue that when you add healthcare and other benefits to wages, that wages have kind of kept pace with inflation. But if you look at just wages, they clearly have not. And I think the trade-off is, in my opinion, outside of the Taft-Hartley world, not readily apparent.
Oh, even for you all. So.
Yeah.
It's just, I don't think it is.
Yeah.
So in the Taft-Hartley world, it's more visible because I guess in that context, you have union shops who are hiring union workers, and then you have non-union shops who are sometimes competing with them. And often the non-union shops don't cover health benefits or worse benefits.
Or they don't cover them as thoroughly,
right?
Or as broadly.
Right.
Speaking of those like negotiations, right? So like Ben was saying, right, for a lot of people who are not union members, right, what their employer does behind closed doors is kind of a mystery, right? They come out and they're like, this is the best healthcare plan we could offer you, but you actually get to sit at the table, right? And you get to hear employers talk about their attitudes towards healthcare and try to wiggle out of spending any more money to ensure the health of their workers. So I was wondering about could you talk a little bit more about, how employers behave at the bargaining table, what you've seen them, how you've seen them try to justify spending less on healthcare?
So in most cases, I am not directly at the bargaining table. I'm sort of, at best in the back room.
I see.
But first off, I actually worked for a while on labor management cooperation. I actually wrote a book called Labor Management Cooperation to manage healthcare costs or something like that.
Nice.
And I was young and dumb at the time. A little more jaded now. But I would say that on balance, employers do not want to offer healthcare benefits. I mean, excuse me, that's not quite right.
They don't want to pay for
their actions. Their actions indicate that they're really not interested.
Right.
And what's really kind of strange is even when the union proposes something constructive, management will push back. They will, and I had a really kind of a funny story to illustrate that. I was dealing with a teachers union in rural Pennsylvania, and I was working for an insurance carrier at the time. It was a brief stint that was informative, but not something I wanted to be doing. But they said, this plan sucks. I said, well, this plan hasn't been updated in like 15 years. I don't remember what it. And you have zero outpatient benefits. And this is when people, this is back in the 80s when things were starting to transition into outpatient settings. So they said, okay, you can come and talk to our membership. So I get invited to an in-service day at the school and sit through some normal business. And then they said, before I introduce the next speaker, we want to take up a collection for Mrs. Teacher so-and-so whose outpatient chemotherapy is not covered by our healthcare.
Now, Jim McGee.
Oh, did that get a nice crowd
It's the hornet's
reaction?
nest.
Well, I blamed management. But they got some improvements in their plan,
Mhm.
but it's just, they shoot, the management will sometimes shoot themselves in the foot or shoot their own workers in the foot. It's not even shooting themselves in the foot, just
Yeah.
because they get their backs up. And
I mean, what you're saying though is it worth mentioning, right? That they're actually shooting themselves in the foot as well, right? Like if you don't actually provide decent healthcare for your employees, then you have a bunch of sick workers walking around, and workers that don't have decent healthcare are likely to be not as reliable. All of those things. Like it might actually be in their benefit to offer benefits to workers, right?
yes.
Just theoretically, just wanted to run that by you. Cool.
And what do you think about, I mean, in the Medicare for All movement, I think we usually tend to see health insurers as kind of the worst of the bad actors, or kind of the villain behind the healthcare system. But when you look at, what actually happens to especially workers' healthcare, it is also largely driven by their employers, right? The insurance plans are coming up with worse and worse products, with more and more creative ways to make it hard to get healthcare. So it's like, I remember when they invented co-insurance, I was like, what the fuck is co-insurance? I'd heard of co-payments. I haven't heard of co-insurance. And then those started spreading and becoming more common, and then limited networks have kind of came with managed care, and then they came in a rebranded format more recently. And so, the insurance plans come up with these creative new ways to limit your access to care, to try and keep costs down. But then employers are really kind of driving that, right, and pushing it on to workers.
Well, it's funny you say that, because you remember the Michael Moore movie, was it Sick? Was that the name of it?
Sicko, yeah.
Sicko. Okay.
Yep.
Mm-hmm.
Yep.
And I remember hearing trailers for that movie, and it was blaming the insurance company.
Right.
And I kept saying, no, you got it all wrong. It's we employers, I mean, I'm speaking from a health plan sponsor role, that tell the insurance companies how to design their plans. So,
right.
But the movie itself was a real eye opener for me, because I realized, the whole thrust of the movie was these insurance company bureaucrats who are closing doors on people.
Right.
But the door that really gets closed, the door to employment, where healthcare is offered. And that is the role that I all of a sudden saw myself in. I said, holy shit. This is what I do. I tell people, you're not eligible for benefits. And, it kind of sucks at times,
Yeah.
And that's the door that should be ripped off with Medicare for All. It should not exist.
Yeah.
So that brings us to this point, which is that, you would think, given that union members in general have kind of more access to healthcare, probably better health coverage in general than non-union workers, there is a real kind of union advantage when it comes to health coverage. But we've seen kind of the labor movement. I mean, there have been times in U.S. history when the labor movement kind of was the universal healthcare movement, was leading all of the work to try and win national healthcare back in, certainly in the 40s and in the 70s. Today, there's a more broad community-based movement, but I'd say still the labor movement is kind of at the forefront. So why do you think it is that unions are, even though many unions, their members are doing comparatively better within the healthcare system, have made Medicare for All such an important part? I mean, not all unions are prioritizing Medicare for All to fight, but some of them really are. And I kind of feel like we're going to need the labor movement to lead the charge if we want to win this. So,
well, I think you and I have talked before, labor movement may not always be your friend, but you definitely don't want them as your enemy.
Right. Yeah. Right.
Stitch that on a pillow.
And it's important that anybody who's engaged in any statewide effort or whatnot, that they reach out to the labor movement, at least to let them know that they're there and what they're doing and what they're working on, and try to bring them in, so that the labor movement is not blindsided. But to answer your question, first off, you have unions with a very rich progressive tradition who can see past the short term and see the long-term value of it. You also have, one of the things that the points that I make, and I'd be curious if somebody could actually document this, but in my experience, the unions who are more exposed to competitive pressure in their work environment are more likely to be supportive of Medicare, because you take, say, the construction locals. My local has always been, the leadership of the local has always been supportive of what I've been doing, to the extent that I keep them informed. And why is that? Because in rural Pennsylvania or central Pennsylvania, there's a lot more non-union competition than there is in the big city locals. And so if you get outside, say, take New York State, for example, you get outside of New York City, and you go out to Rochester or Buffalo or Albany, you're going to find locals that are going to be more supportive of this, because they feel the pressure. They feel the pressure from the non-union competitors, but also insulated from competitive pressure of public sector unions. And unless they are in a hostile political environment, which some are, but they tend, and sometimes it's too late when the environment turns on them. But I think, first off, as long as I've been in this business, healthcare has been the number 1 cause for strikes. So that by itself it should be a motivator, is a motivator. Right. Taking healthcare off the bargaining table and making healthcare available not just to workers and their immediate dependents, but to workers and their brothers and sisters and mothers and fathers and aunts and uncles and everybody, their whole community, so that it shouldn't just be the immediate workforce that's and their family. And when you come right down to it, why should an employer pay for a dependent coverage?
That's a good question for an employer.
And they don't want to, that's for sure.
No, they don't. And a lot of small businesses exist on the backs of these employers who provide dependent coverage. When I was working with the AFL-CIO in Vermont, and I got introduced to this guy who had some costing proposal. I don't remember what it was, and he was taking exception to a uniform tax on wages or income or something. And he said to me, and it was an office building of maybe like 5-6 floors, and kind of the standard office block thing. And he said, if you tax all employers, you're going to have everybody in this building against you, because all of those small businesses in that building are dependents of somebody who's working for the state or working for the university or working for the postal system. And is that an equitable system?
No.
But I also wanted to another factor too is getting that first contract is the biggest challenge. And if you have a bargaining unit of 30 or 40 or 50 people, it's hard to find health insurance for that kind of smaller group market.
Right.
Yeah.
especially price competitive health insurance.
Mhm.
You know, and it's really sad that you know, the groups that supposedly represent small businesses don't on that issue, because they make money selling health insurance to their members. The NFIB and the Chamber of Commerce
Right.
frequently,
Wow.
you know, offer insurance programs.
Right.
That's
Same thing
something
as
we
like
don't think about.
AARP.
Right.
Yeah.
You know, you mentioned strikes, and I just personally, I have to give a shout out to the graduate student workers at Boston University who are right now on strike, in part for better healthcare. I started out as a grad student at BU in 2001, organizing with other grad students for better healthcare and health benefits. And I have never been prouder to be a terrier than seeing these folks out on the picket line demanding decent health care. So solidarity to y'all at BU and all the folks around the country right now who are on strike for better health care. And it's
But,
more
you
than
know,
it
tell
should
me,
have to be.
I mean, there's two sides to this coin.
Mhm.
One is, really, we should have to strike for healthcare?
yeah.
It's a lot.
Yeah. I feel like
And two, really, you're going to lose your healthcare if you go out on
You
strike?
go on strike, right? I was going to say that.
yeah.
This is another reason that I think the labor movement should care about Medicare for all is when you go out on strike for any reason, I mean, losing that health coverage is one of the biggest bludgeons they use to try and break a strike. So,
Right.
yeah.
That's right. That's right. Like what percentage of strike funds goes paying
And you know, and
healthcare prices?
when you come right down to it, why should healthcare be a factor in deciding where you work? You know, I'll tell you a story. My sister many years ago was volunteering at the local Red Cross in rural Pennsylvania, and the executive director left, and they asked Maggie if she wanted a job, and she said, "I'd love it, but do you have health care?" She said, "No, we can't afford to provide health care to our people." So she didn't get a job that she might have enjoyed, and they didn't get the employee that they might have rather have had.
Yeah, exactly.
Wow. Yep. Healthcare making decisions for us. I do not like it. I do not like it.
Yeah, people who, it's funny when people are like, oh, you're going to lose choices if you have Medicare for all. It's like, well, right now, basically our employers choose for us what our healthcare is or isn't, right?
So,
I mean,
so
it's
this
such a
is another
paternalistic system. Like,
you know, the choice we have now is among insurance companies. And each of those insurance companies have networks, plan designs, plan rules, all that kind of stuff. What you want is to be able to choose underneath that. You should have a tent big enough to cover everybody's choices. And that's what Medicare for all offers. You're not choosing between an insurance company and finding out too late that your doctor is not in there, or it doesn't cover the drug that you need, or you know, maybe you know,
Right.
Your health needs change between the time you made your choice and the time you're stuck with your choice. You know, it's just it. And then there's this other aspect of it that is increasingly driving me bonkers. And that is, you know, this is hard on the provider community.
Yeah.
So our plan has Kaiser, which is a staff model HMO, and we have Blue Cross Blue Shield, which is not. And so the doctors in the staff model HMO, Kaiser determines the formulary. You never, ever hear a complaint from a Kaiser member that my doctor prescribed a medication that is not on the formulary. Because they have one formulary and they know what it is. And they know the process if they want to go around the formula or get something outside the formula. They know the rules, they know how to navigate it. If you, and I just use pharmacy because it's a simple example, and I'll give you another example later. But if you're out in the broader world, every single benefit plan out there potentially has a different formulary. So you just prescribe whatever drug the salesman stopped by last night and gave your staff dinner or whatever the guiding principle is. So this lack of uniformity within the delivery system, I think, really adds to the total cost of the system in ways that we barely comprehend. And I heard an interview one time on NPR that really stuck with me. Are you familiar with bariatric surgery? You know what bariatric surgery is? So
I've had it pitched to me many times.
So they were interviewing the guy who developed the protocol for bariatric surgery. And he says what's most infuriating for him is now he's got a half a dozen insurance companies that are coming into his hospital to see if they're following their protocol for bariatric surgery. Now, does that make sense?
You mean
that's
having
just one
insurance
procedure.
Administrators choose how we get treated? Literally?
Yeah, they do. They
Yeah.
do. I mean, it's just it's screwed up.
Yeah.
Screwed up. And this whole notion of choice is truly counterproductive.
So to kind of wrap this up, not to ask you to predict the future or anything, Jim, but you had said before we started recording that, I guess you attempted to retire and then you were brought out of retirement back into this world of health insurance administration, and you said things have been getting pretty bad in recent years. I assume just like as healthcare costs rise and rise and rise faster and faster, especially with inflation. It just applies pressure to everything else, the ability to afford all this stuff, and it makes life really difficult. How do you see the sort of the labor movement reacting to the healthcare system getting worse and worse, or just the cost pressures kind of bringing to bear more? Do you think that we're gonna? I mean, some of the labor movement is already there on Medicare for All, but some is not quite there yet. Do you think that we're going to see more kind of engagement around Medicare for All, especially next time healthcare is on the table, in Congress and the like? So,
I wish I had a simple answer for that.
Yeah.
This privatization of Medicare,
right,
and privatization of healthcare in general is really scary. Just truly, and what's one of the things that we experience is we offer our members a very good Medicare supplement plan, and also we now have to offer a Medicare Advantage prescription drug plan. But you get this dunning from these carriers who say, if you're not enrolled in my Medicare Advantage plan, you're not enrolled in Medicare. So we have people who sign up for one or more of these plans, and then they lose our coverage because and so then we have to get on the phone, sometimes with the member, sometimes with the carrier, and get them to straighten out exactly what happened. This just should not.
Probably advertising happens, right? They've been incessantly advertised.
These companies should not be allowed to pass themselves off as Medicare.
Right.
That's for sure.
And it's counterproductive. And CMS, the Medicare, the traditional Medicare, they're not out there advertising in the same way.
Mhm.
And kudos to Medicare Advantage. It's a lot simpler to enroll in a Medicare Advantage plan than it is to enroll in Part A, Part B, Part D, Medicare supplement, all that stuff that is kind of rolled into one with Medicare Advantage. So one of the things that Medicare needs to be streamlined and made simpler and made more. Medicare Advantage Medicare, in my opinion, doesn't even comply with the Affordable Care Act because of the out-of-pocket maximums.
Right.
And so we need to beef up Medicare. We need to make it harder for Medicare Advantage companies to make money. And
amen, Jim. Amen.
Yeah. And that's what we got almost kind of close to doing with the Build Back Better bill. If it weren't for a couple of senators, Joe Manchin, Kristen Sinema, thank you very much for blocking that. There were some improvements made in Medicare, but I agree with you, especially buttressing traditional public Medicare is maybe the best way to keep people out of the grasp of Medicare Advantage plans. But yeah. And do you think that the labor movement is gonna come around on Medicare for all? At least the wings of the labor movement that have not yet, just because they're feeling continuing to feel the pressure on.
Well, I have to believe that they will.
Yeah.
All right.
Let me put it that way.
I agree too. And both of us, Jillian and I, both have kind of labor-ish backgrounds as well. So.
Yeah.
All right. Well, thank you so much for joining us today. The world of union health plans is really interesting and covers a lot of people in the country. So, and thank you for doing the work of trying to demystify health benefits for workers as well. I want to thank our podcast team, without whom we could not do this podcast. Our podcast manager is Angelique Davis. Our show notes writer is Jerry Katz. And our audio editor was Craig Stanton. So just everyone, don't forget to like the episode, subscribe to the podcast on your favorite platform. And this show is a project of the Healthcare Now Education Fund. So if you'd like to support our work, you can donate at our website, healthcare-now.org. So thanks, everyone. We'll see you in 2 more weeks. Bye.